Bismillahirrahmanirrahim. This is the first lecture, which is about the introduction to the forensic medicine. And forensic medicine, the word forensic medicine is basically derived from a Latin word forensis, which means the forum. And this forum in ancient time in the Rome was the place where the civil and the legal matters were discussed by those who were the public responsible. That mean the administration or the judiciary, where the cases were presented and they were discussed regarding its legal implications. Then the word sophrensis conveys that it means any issue which is relating to be discussed in the court of law. That means whenever an issue arises between the persons, between the parties, that is to be discussed and decided in the court of law. So we know the medicine is basically the principles of practice of medicine, that is the application of the principle to arrive at a diagnosis for the medical purpose. And when we combine these words, forensic medicine, so this means that any issue which is related to medical practice and it is to be debated in the court of law. Then there are different names which are used for the forensic medicine, like for example, we know forensic medicine. This means the legal aspect of medicine. That is, we are practicing medicine, but there are certain legal aspects which has to be cared. So this is the branch of medical science which deals with the application of principles and knowledge of medicine for the purpose of law, both in civil and criminal, and all this is to be done for the administration of justice. And whenever there will be administration of justice, the society will be bettered. So that will the betterment of society. Wherever the other name like the medical jurisprudence, which means the medical aspect of law. Jurisprudence, that means the law, juris is law and prudentia is knowledge. So that means a medical knowledge which is related to law, or it means the legal principles that guide medical person about the medical legal issues during the course of treating patients, responsibilities and the rights. Whenever we are uh, conducting the medical legal or medical examination, there are certain responsibilities to be cared by the doctor, and there are certain rights which are to be looked into for the rights of the patient. Then the other name which is also being used in certain part of the word, that is legal or the state medicine, and this is used basically in certain parts of the Europe. The legal aspect of medicine, forensic medicine, and the medical aspect of law, medical jurisprudence, they are all called in those parts like legal medicine or state medicine. State medicine means that we conducting medical legal or medical examination for the state. That the state is responsible to take the care of the patient's right, and we being the medical man have to determine various types of assaults for the uh, administration of justice to be delivered in the court of law. Then when we talk about the scope of medicine, the scope of medicine is unending. Whenever there is application of medical knowledge or practice of medicine, whether it is on the living or it is on the dead, there are the rights of the living as well as dead, both in civil and in criminal cases. Then the examination of all types of assaults, which are the physical assault, like the damage to the human body, or the sexual assaults and the poisoning. So these are various uh, aspects which are commonly delivered to harm the other person by injuring, by assaulting sexually or administration of poison. They are all in the purview of forensic medicine. Then there are certain situations will be discussed in the forensic medicine which plays a key role in the medical legal situations. And these situations may be on the living person or on the dead person. And these are, for example, the criminal investigation. Whenever there is a person is dead, the autopsy has to be conducted, and the autopsy is basically determination of the cause, mode, and manner of death, time since death, and identity. Sometimes it is the core issue when there are extensive mutilation or uh, skeletonized body or putrefied body, or there are certain mass disasters, then this has to be identity becomes a major part. Then in medical legal examination of injured, whenever there is certain person injured and comes to the emergency, we have to find out that this is accidental or suicidal or homicidal, and what is the nature of injury and what was the mechanism of injury, that how it was instituted, we have to determine. So this is the medical legal examination of the injured. Then in poisoning cases, there are medical duties and the legal duties. Medical duty mean that we have to save the life of the patient, and there are the uh, steps which has to be taken up for saving the life. Then there are also certain legal responsibility. That means the collection, the isolation, and identification of the poison or the drug which has been instituted, and that can be collected from the stomach wash, from the blood, from the urine, or whatever the material which is available. Then we have to determine the manner of infliction. Then find out the impact of poison on human, how much damage it has conducted. Then what was the cause of death? If person dies, what are the causes of death? Then legal proceeding, that after examination we have to appear in the court, and we have been we have to be testified, and this testification, when we appear in the court, we present our medical legal examination which have we examined on the injured or on the dead in autopsies. We have to appear in the court of law, and on the one end we have to present those findings as an uh, evidence. Then we have to draw a conclusion being an expert evidence, and that is the most important, which is the technical evidence, our expert opinion, that what was the mechanism of injury, what weapon was used, and similarly to find out the cause of death. So this is expert testimony as an medical evidence. Then there are issues regarding the ethics. So we have to study medical ethics and malpractice, which is the civil negligence. So the medical negligence and the all those aspects, they are in the purview of the forensic medicine. Then sometimes the issue arises regarding age determination. The matter may be the civil matter or the criminal issues, and the civil matter may be employment or any other marriage or retirement. Then the criminal issues like the absconding soldiers or any other criminal issue. So the age determination becomes an important parameter for determination in medical legal examination. Then applying our biological, radiological, and skeletal data, the age is determined, because most important is that sometimes the plea of being juvenile is taken in the cases where the capital punishment cannot be awarded. So determination of age is most important. Then civil and family laws, wherever the issues like disputed paternity or maternity arises, then the we have to establish this issue by complete examination of DNA fingerprinting, that we have to study the DNA print and match it with the paternal or maternal chain, and then we establish the issue. Then we have to prepare the injured certificate, because sometimes the compensation has to be awarded by the insurance or the workplace or any other place. So we have to issue the injury certificates, which is the requirement. Then the sexual assaults and abuses, these are the issues or the cases which we have to determine and present them in the court of law. And it needs detailed examination of the injuries on the victim and assessing its psychological impact also. So this is a very important and technical, that you have to examine the victim. It may be a male victim in sodomy or female victim in the rape or zina. Then you have to find out the damage and give a report. So this is an important job of the doctor, to assess the sexual assaults and abuses. Then regarding public health and safety laws, there are certain occupational diseases that people working at some places, and they are exposed to issues like health, and we have to assess the injuries and their illness regarding their occupational exposure. So sometimes this is very important. And in mass disaster like the earthquakes, the train accident, the air traffic accidents, plane accidents, or in a terror attack, there are mass destructions, mass disasters. Victims are more than one, and there may be commingling, that the mixing of the body parts. So we have to isolate them, identify, find out the cause of death. This is very important aspect of the forensic medicine. Then the psychology and psychiatry, mental health evaluation is sometimes important, because the criminal responsibility is the most important job. Unless we fix the responsibility of a crime on a person, he cannot be awarded punishment. So for criminal responsibility to be fixed on a person, he should be of sound mind, that he should not be insane or any psychiatric illness, and he should be adult or mature enough to understand the nature of the act. So this criminal responsibility have to be established, and excluding the mental health. Then psychological support of the victim, because sometimes there are mental issues which are related to victims, and these psychological issues are in cases of, especially in cases of the sexual assaults. So their support is very necessary. So this is also the job of forensic medicine, to refer the cases for the psychological evaluation. Then there are certain advanced techniques in forensic medicine, like differing DNA fingerprinting and profiling. And this means that we analyze the genetic material and we identify the persons, and that person may be either victim or the assailant. So it helps us in identifying the individual. Then there are certain radiological and mass imaging techniques which help us in analyzing and confirming the medical legal examinations. Then the role is also educational and training. We have to educate the law enforcement, judiciary, the medical aspect of law, and the legal aspect of medicine. Whenever we are working in a certain tertiary care or teaching hospital, we also give knowledge to the police, judiciary, regarding the aspects of injury or aspects of autopsy, and inform them, educate them, so they can better understand and investigate the case, and and it helps in the judicial proceeding also. Then community awareness, we should, being forensic expert, we should promote the awareness in the public, and which are the most important issues like the domestic violence, the drug abuses, or injury prevention. So these are the some of the aspects where the forensic medicine can play a role, and domestic violence can be highlighted and it can be prevented. Similarly, the drug abuse and the injury prevention. So the conclusion of this talk is that a forensic medicine is basically its search for the truth, that it finds the fact, and the fact is the truth in a very any particular case, which is either the civil case or the criminal case. Forensic medicine finds the truth, and that truth is basically the fact which we find out, and that fact is the evidence which helps in crime investigation. And how it helps in crime investigation is that the truth forms a link between crime and the criminal, and the criminal helps to the law enforcement agencies. Then the law enforcement helps in the protection of public, and the protection of public is by the administration of justice. So ultimate aim is the administration of justice. So from crime, all the chain leads to administration of justice. So forensic medicine plays a basically very important role in bridging the gap between medicine and law. That means wherever the law needs the help of medical man, they will refer the case to the law authorities will refer the case to the doctor, like determining the age, determining the injury, determining various issues. So the doctor, being a doctor, will apply the principles of practice of medicine and will find out the fact, which is the evidence. And when we are conducting medically, that we are examining a patient, that we are finding out the disease or the diagnosing, then there are certain laws which govern us, like the consent laws, the ethics, the negligence. So all these laws, they govern us. Then there are certain bodies which award who are the doctors who are going to deliver the medicine. So this is a interrelationship between medicine and law. So forensic medicine plays a very important role, and it bridges the gap between medicine and law. And we say it multidisciplinary because it doesn't have any boundaries. Wherever the medical legal issue arise, the forensic medicine will come into play. And not only the medical legal examination, it helps in criminal justice, civil disputes, public health policies, and establishing the ethical standards. So it has got very important role in the society. So forensic medicine and allied branches, disciplines which we study, there are certain branches which help the forensic medicine. So forensic medicine has no definitive boundaries. It is not limited to any particular sphere, because wherever the medical legal issue arises, we are conducting as a surgeon, we are conducting as a physician, we are conducting as a gynecologist. Wherever the medical legal issue will arise, the forensic medicine will play its role. However, the forensic medicine take the help of certain fields like forensic toxicology, forensic pathology, odontology, psychiatry, anatomy, radiology, and serology. So forensic toxicology, it is the basically branch of pathology which deals with the medical legal investigation of death. And forensic pathology, it promotes awareness about the issues like domestic violence, drug abuse, and injury prevention. And forensic odontology, the teeth gives very important information regarding injury, age determination, or crime investigation. Similarly, the forensic anatomy, the aspects of anatomy help in various medical legal issues. Sometimes a bone is presented and we have to determine this bone is a human, and if human, we have to determine its identity, its cause of death, its dating. So this is very important field regarding forensic anatomy. Then forensic radiology, we take the help of X-rays, we find out the fractures or we find out the damage, we find out the metallic bodies or the bullet inside the body. Then there are certain special techniques like MRI and CT scans which help in virtual autopsy. Virtual autopsy is autopsy that without opening the body, without cutting the body, with the help of MRI and CT scan, we can find out the internal damage. And this is becoming a very important field. Then forensic psychiatry, it is a branch of psychiatry which deals with the legal aspect of mental disorders. We have to help the patient when he is going through trauma, psychological trauma, he needs help. And sometimes the plea of insanity is taken, and then the forensic medicine, forensic psychiatry have to establish the person is actually suffering from mental disease or not. So the criminal responsibility have to be fixed. Then forensic serology, it means all the biological remains. And whenever there trace evidence is an evidence which is left on the scene of crime as a trace. And that trace is very important. It will lead to identity. And that trace can be a biological or non-biological. When it is biological, then it is forensic serology. That means the saliva, the blood, the semen, or the urine of that individual. And from that, we can establish the identity and help the establishment of the crime. Thank you very much. Jazakallah.